welcome to my channel. I'm Mama J. Today I'm here to talk about tips on chemotherapy, how to avoid getting neuropathy, how to avoid getting pain in your hands and feet while you're going through chemotherapy and afterwards. So what I recommend is having a soft cooler. I have the Yeti one here, or you could also use any kind of a soft cooler that you have. Even a hard cooler, if your feet can fit into it, will work for you. So basically you want to ice your hands and feet so you don't develop pain in your hands and feet later. So you also need some ice packs, and I recommend these Yeti ice packs. They're heavy duty. I had the two bigger ones, and also they make a skinny one like this where you can hold and put your fingers on it, and it's just the right size. So you put all these, be sure to freeze them overnight. The longer the better. So before you go in for your infusion, freeze it for 2-3 days, but at least overnight. Also get some plastic bags. Produce bags will work. Any kind of plastic bags will work, which will fit these ice packs. It gives you a little bit of a barrier between your skin and the cold ice, so you can endure the iciness. So you put ice packs in the bag like this, and then you can also, if you can find these food gloves, you could also use that and hold the ice if you like. So put these in the ice box cooler, and then wear thin socks, not too thick. I wore Old Navy socks, and you just put your feet in the cooler at the infusion center, both of your feet, and make sure your toes are definitely touching the cold ice. That's the key. And you need to do this especially for Taxol. Most people get Taxol going through the cancer treatment. So once your pre-treatments are wrapping up and they're ready to turn on the Taxol, that's when you stick your feet into the cooler on top of the ice, and that's when you hold the ice pack. You also want to drink something cold like ice water, or the hospital has ice chips. I would ask a cup of ice chips, and I would just eat the ice chips with a spoon and keep it in my mouth, which prevents mouth sores. I didn't have any issues with mouth sores, and I'm actually very susceptible to canker sores, but having something cold to drink or ice chips really prevented any of those issues for me. Also, I was really craving iced Americano, and luckily there was a Starbucks in my hospital, so sometimes I would sip on the iced Americano if my infusion was in the morning. So Taxol starting, stick your feet into the cooler, both of the feet, hold the ice or hold the cold drink. Make sure your fingertips are touching and your toes are touching the ice. And actually it's not that bad. You'll be able to endure it, and if it gets to be too cold, you could take little breaks. But you want to do this for the whole duration of the Taxol and for every Taxol infusion. Really recommend these heavy duty Yeti ice packs. Get the soft coolers. You can do it. Good luck. Come back. Please hit the like button and subscribe button, and come back for more tips on going through chemotherapy, radiation, and other treatments. Thank you, everyone. I hope this was helpful.